Hi there, Dr. Robert Walls here with you at Texas Wellness. You may be wondering what sleep disorders has to do with wellness. Well, let me tell you, just about everyone that has a lack of wellness is also suffering from a lack of sleep. They kind of go hand in hand. So in many cases that I see, I've got to help folks with their sleep. And it ties right in with what I do in stress management and weight reduction. And what I see clinically is if someone's having trouble losing weight, then they're probably not sleeping good. If they're having a lot of pain in their daily lives, they're probably not sleeping good. And if someone has a blood sugar handling problem, stress problems, they're not going to be sleeping good. So treating sleep disorders is kind of a natural spin-off from your everyday wellness practice. And so what we do here with sleep disorders is, first of all, we got to look at your stress levels. We've got to get those under control. And everybody's saying, well, you know, everybody's under stress and there's nothing much I can do about it, but really there is, and it's called lifestyle modification. And in lifestyle modification, we need to look at those stress levels on a 24-hour period. It's called a circadian rhythm. And cortisol rises and falls depending upon what our needs are for it. As you may or may not know, cortisol is the stress hormone that is able to give us the so-called flight or fight response. So as it turns out, we want to see appropriate levels of cortisol when we're trying to go to sleep, and once we get up in the morning and go about our daily routine. Clinically, what we see is someone that is in the exhaustion state of adrenal failure, they will have not enough cortisol in the morning, and it will rise up until about noon, and then in the afternoon it starts falling off, then it starts going up again when it's time to go to bed. And these folks may be having trouble going to sleep, or on the other hand, maybe they can go to sleep, but then they'll wake up typically at 2 a.m. in the morning and they won't be able to go back to sleep. Either way, it can be very frustrating. Now, we have to ask ourselves, what is causing this problem in sleeping to start with? So, it can be that the stress is not handled correctly. It might be that you as a patient need some adaptogenic herbs to help you cope with the stress. You may need some amino acids in certain parts of the day to either increase or lower your cortisol levels and try to get the diurnal response back into the curve where it needs to belong. And there are other things that can affect this cortisol phenomenon, such as chronic pain. Chronic pain is going to initially keep the cortisol levels ramped up at all times, but eventually it's going to lead to adrenal failure, and we will see certain patterns of hormonal response that occur in response to that. One of the things that we often see is decreased DHEA. Now, that particular hormone, which is kind of a pre-hormone, it's one of the first ones that the adrenal gland kicks out on the way to make your sex hormones. It will eventually become severely depressed to where you can't make enough testosterone. As a matter of fact, that's a pretty good strategy for helping men that have low T. You can go ahead and give them some DHEA, and there are studies out there that show that that will indeed increase the T levels. So getting back to the sleep problems, how do we diagnose that and deal with it? Well, one of the ways that I've already mentioned is monitoring the adrenal hormones, and another one is balancing the sex hormones. Another one is to look at the hormone responsible for sleep primarily, which is melatonin. And the time that we want to check melatonin is when you're having trouble going to sleep or falling asleep. Another strategy is neurotransmitter testing. Now there are several levels of neurotransmitters that we need to look at, and we've got serotonin, we've got possibly dopamine sometimes, histamine, and a few others that are important in sleep regulation. And we use the neuroscience testing kits that dovetail in with some of the nutritional strategies that we do for sleep problems. And the way it works is that if you're having trouble going to sleep, we will have you pull out this test before you go to sleep and do a hormone test where you spit into a saliva tube, and then we'll do the neurotransmitters where we will catch your urine. So the other part of the diagnosis of your sleep condition, or the quantification of it in the very least, would be a sleep study test that we do with a small device called the sleep image, and I don't have one right now, but the sleep image device is about 1/3 the size of an iPhone, and it weighs less than an ounce, and it's basically a 2-lead EKG that will measure the cardiopulmonary rhythm. And what that is the coupling of your heart rate with the rise and fall of your respirations. And there should be a rhythm there. And this very small device prints out some beautiful graphs that will let us know when you're sleeping good, when you're not sleeping good, and it's a means of quantifying how you're getting better as your treatment progresses on through. So for about $500 or less, we can do the neurotransmitter testing, the melatonin testing, and also your sleep study, which is a lot less than you would ever get at a regular bricks and mortar sleep testing facility. Now, I believe a lot of you have probably heard about those type facilities, and usually what you hear about from the results of that testing is that they come home with a CPAP. Now, CPAPs have certainly helped a lot of people with some sleep difficulties, but that is only a small part of the lovely world of sleep disorders. So that device does not address neurotransmitter imbalances. It will not address a lack of melatonin, and it will certainly not address lifestyle issues that are causing or contributing to your sleep problem. So if any of this is making sense to you, I'd like for you to give me a call at my office. We'll send you out some forms, and we'll make an appointment to come in, and we'll discuss your sleep problem. And along with that, we may look at you in a functional medicine perspective, and we'll also want to look at you from a neurological point of view to see if there are some pain problems or some other levels of your nervous system that might need to be addressed to get to the bottom of your sleep problem at a root level. So once again, if that's making some kind of sense to you, feel free to call us, and we'll be glad to see you and help you as best we can. Thank you.